Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today I would like to share you with one of our previous patients we did in 2023. His name is Dale, he's 26 years old. We have his results and I would like to share my evaluation with you. Let's start with his hair loss type. We just check first the photos that we take before on the operation day, and according to those photos, as you see, he's like Norwood 5 to 6, I think. But the good thing, sometimes there are some good things with the patients that is positive for us, which means that the frontal recession is always continues with the mid scalp, and sometimes it continues with the crown, as you know. But the passage from the front to the crown, if it is too narrow, it means that we need less graft to cover. So for example, this part was much better for the patient, but on the other hand, yes, a larger frontal part, also a larger crown area we have. So this is a typical 2-session patient that needed 2 sessions at least. Okay, let's start with the planning. One thing we always decide with the patients is that what we decide for the hairline and hair style. We always want patients to bring their photos to us to see what we can do with the previous lines, but sometimes according to number we would like to take it higher because we want to cover more areas or we want to give more density. I think in this patient it was the right decision of the line. In the left side, I think he has a longitudinal scar like 15 or 20 centimeter, but mostly our plan was to restore the frontal part, then do some mid scalp and the crown. This is the crown area. You can see in just center of the crown there are thin hairs. Surrounding the peripheral part of that circle is more thicker hair, which is good. If it's a total crown area baldness, then we think that there is not enough circulation because it becomes more atrophic, which means that circulation will be lowered. But if there are already hairs there, if the patient is young, if the patient has underlying etiology of any disease, at that time the circulation is good. So whatever we implant to the crown area will be a better success rate. Okay, let's check the 13th day photos right now. Patients are always curious about how they appear at the 2nd week of the operation. With this patient, it look like that he has still some scabs on his scalp. I think at that time we tell him, or in the next following days, probably he removed those scabs as well. But after the 10th day, we want patients to remove scabs because it prevents the hair growing part and it doesn't look very nice at that time. Just to be socialized, I think it's more important to remove them. But as you see, it is like, yes, in some skin colors it's more visible because of the redness or because of the sensitiveness. In more darker skin colors, I think it looks a little bit better, that you can just go outside very good. Alright, so the 3rd month photos, let's check them. We do not expect too many hair growth in the 3rd month, but starts to grow at that time. It's not synchronized, so they don't grow in once, but as you see, in this patient we see some onset of the growing, which is good. His donor area is healing. Let's jump to 6-month photos. In the 6-month photos, we sometimes see the final result, even very close to the final result, or sometimes we are seeing the hairs growing, but it's not become thickening yet, or even the 40 or 50% of the result. Sometimes we see or 70 to 82, but don't compare yourself with any other patient because it could be so different. So you see the hair is coming up. It's good. Even the patient could be happier at this time, but it's not the final result for sure. Okay, so let's check Dale's 9-month result. From front, very good, very thick, very good. He changed a lot. I think he has also a little bit darker hair color because when the hairs becoming receding, it's more blonde because it's weakness. It also has some baby hair appearance. So when we transplant it from the donor area, it's more darker. So patients has a little bit darker hair color. So it happened the same thing with him. When we see from side, looks good. From this side, because he's combing from left to right, it looks very good, very natural. It's not very noticeable. I think patient is happy in this part. When we are looking from the top, we feel the frontal part, we feel the body area, mid scalp is good too. I think crown needs some time also. As you see, it's better in condition, but not very full. But probably it will be more taking more time to be having a better result. In this part, we always want patient to use minoxidil just to improve the thickness, improve the circulation of the area, because it's the top of your body. There is no enough circulation. Minoxidil is a vasodilator thing, and it increases the blood flow to that area, which is very essential after the transplantation because it's newly transplanted area and it needs a vascular supply. That's the reason it's essential. So we advise these kind of patients to use it. So looking forward to see his results in the long term. But thank you for watching us. If you have still questions, you can ask anytime just below the video, and we would like to answer them. Thank you.